Hi, everybody. Today I'm going to talk about the COVID-19 pandemic that we're in. We are in a world crisis. We are, there are words that we're using that we wouldn't have thought of using a month ago, as in social distancing, self isolating, flattening the curve. This is a worldwide crisis that we're in, and we need to take a leap of faith. We need to step back. Because of this pandemic, a lot of people are not working, and I know that there is a lot of anxiety and fear happening right now. We need to lessen that anxiety and we need to lessen that fear. We have to look at where we are getting our facts. Social media, from what I could see, is driving that fear. We have websites that we can go to. Let's use our platforms to get the facts so that we can stop the fear. Because of the anxiety and fear, there is hoarding happening. When you go to the grocery store, there are a lot of shelves that are empty. The fact is, and I heard this on the news this morning, that there are a number of CEOs from large grocery stores saying that we are not closing down. The reason that these shelves are empty is because people are hoarding and they are trying to keep up. So I'm here to address the anxiety and the fear. I know that the fear of the unknown is scary, but when we get the facts, it can lessen the fear. If we go to canada.ca, ontario.ca, there are facts there with what is going on. Another way to lessen the fear is to stop having that news on in the background 24/7. That is just going to exasperate that anxiety. The World Health Organization declared COVID-19 a pandemic. There are actions being taken throughout the world. There are businesses that are closing down. There are people that aren't working and concerned because they're not getting a paycheck, understandably. But I know that from everything I'm reading, the government is going to help those people. One thing we really need to look at are the people that are working, that are in those grocery stores, that are in the hospitals. We have the healthcare workers. Thank you to all the healthcare workers for all that you are doing. When you're in the grocery store, thank those people that are stocking the shelves. They also have families that they're concerned about and their safety. And they are out there working to keep those shelves stocked. There are a number of things that we can do to get through this. And I think back when 9/11 happened, it brought people together. We were in solidarity, and that was that affected the world. That was huge. Just like today, this pandemic is huge and it's affecting the world. I believe that we can get through this if we take that leap of faith and believe that what we are doing is being proactive. We are trying to flatten that curve of illnesses so that instead of it going up quickly, have it flatten out and start coming down. We need to flatten that curve so that our medical workers can work towards helping the people that are ill. Also, a fact is that not everybody that gets COVID-19 will die. What they are doing is treating the effects, the symptoms of it. The people that are mostly affected are people that already may be ill and their immune system has already been affected before this. And that's why it's important for us to stay healthy and have that social distance, and going back to the basics of what we already know: washing your hands, don't touch your face. When you do go out to the grocery store, wipe down the handrails, because the virus will live on hard surfaces for a period of time. Be mindful of what you're doing. Check in on your neighbors, check in on the elderly. I loved that some of the grocery stores are opening an hour early for the seniors to do their shopping. We need to go back to the basics. Spend time with your family. There's a lot of people that are not working right now because of this, and myself being one of those people. And I'm taking this opportunity to do those things that I've kept putting off. I am in the midst of going through old files and recycling all the papers, doing those tasks that we never get around to doing. Spend time with your family, play some board games, go for a walk, do something nice for somebody else. Donate to the food bank, because there are people that still need to eat. And, it seems that when we're in a crisis like we are right now, what I am seeing a lot of, and it's not the majority, thank goodness, people being selfish and hoarding and buying more than they really need. I understand that it's the fear and the anxiety that is driving that. But if we just take a breath and trust that what we are doing is a good thing. We are being proactive so that we could flatten that curve, so that the illnesses don't rise. You have time now. You have time to spend with your family, to binge watch. I just want to say that it's time to take that leap of faith and trust that what is being done is for our higher good. I've always said knowledge is power. Where are you getting your knowledge of what's going on? Is it on social media, or is it on websites that have the facts? Educate yourself. This virus can be caught through coughing, sneezing, saliva, and it also will land on hard surfaces. So sneeze in your arm. Wash your hands regularly with soap and water. And if you don't have soap and water, have some hand sanitizer. All I can say is this is a time to come together, not apart. We can get through this together. Check on your friends, your family, FaceTime with them. You use social media and our wonderful world of electronics and cell phones to be in touch with people. Remember, where there is breath, there is hope. We will get through this together. Sending you all lots of love. Take care, everybody. We got this. Take the leap of faith. Cheers.